Every day is different when you're a cardiologist. Some days are mostly taking care of patients. We're going to take a small catheter and we're going to put it down in the artery in the leg and head up towards the heart. We're going to inject some x-ray dye and look to see that if you have any blockages. A typical day will start out somewhere between 6:30 and 7:30 in the morning. We may start out with a teaching conference where we discuss patients or a new research data that we have. You got to be like a sharpshooter to catch that. Teaching is a big part of what we do at Emory. His EKG is normal. And a lot of our day will be in instructing young doctors on how to do these types of procedures. Being a cardiologist allows you to take acute care of patients. If we find those blockages, we divide them up into kind of two types. Some that we might suggest fixing, and some that we might suggest treating with medicines. The reasons we're doing this is because that stress test that you had was a little bit abnormal. Do you have any questions for me?
If you find a blockage, you decide if it's going to be treatable or fix it. Are you going to do it right then?
Usually yes. The best thing to do is always talk about anything that concerns you, and then we can sort it out. Most people who have heart disease are completely healthy until they realize they have a problem. People that are having a heart attack will usually experience some type of symptoms. Typical symptoms from a heart attack will be chest tightness or pressure or pain, difficulty breathing, maybe a feeling of dizziness or feeling sweaty or feeling like you're going to pass out. A patient who comes in with a heart attack will usually come to the emergency room and they'll be quickly brought to my area of the hospital. Most of my day is actually in what's called the cardiac catheterization lab, taking care of patients that require a heart catheterization to see if they have blockages in their heart, and then also doing coronary stent procedures. Once we find where an artery is blocked, we'll place a catheter in to relieve that blockage. The blockage is what causes the heart attack and limits the way blood flows to the heart muscle. By relieving that blockage, we restore blood flow to the heart muscle and improve the survival in a heart attack. We continue that tradition of excellence in patient care, teaching, and research. There's a lot of Emory in the community, and Atlanta in general is very lucky to have an institution as large as we are.